And we are back, and joining us now is Sigalle Reiss, who is the, what is your title, Sigalle?
Public Health Director.
There you go. And we're going to talk about Interface. And it's a new mental health helpline that I think is not a lot, I was going to say a long time coming, but I don't mean it that way. I think it's something that's important, and I think it's probably going to get a lot of use.
Yeah,
so tell us about it.
I hope so. So I want to emphasize it's a helpline. So it's a phone number residents can call, and if they're looking for mental health outpatient treatment, to find providers. And it really came out of different coalitions, different groups in the community. We're seeing the need for something like this, both with seniors and with youth. The need to navigate through the very difficult process of finding a mental health provider. And what this is the Interface Referral Service out of Williams James College has an extensive database of practitioners that they can sort through and find location, availability, insurance needs, and they can help navigate through that process and sort of be the middleman to make it a smoother process for people to find care.
So how would it actually work? I'm sitting at home and I don't know, I'm feeling depressed or something, and I say, I think I need to speak to somebody. Yeah. And so what do I do?
Well, first thing is you want to reduce the stigma so people feel like they can call. So that's also something that we're working on. But when somebody is ready and looking for care, they would call the 800 number where they talk to a professional on the other side that has a mental health background. That would go through a series of questions to find out the exact need, the specialty, the age, location, availability, all those criteria, insurance obviously. And then they would get back to you with 3 or 4 providers that have availability. And then what they do is they actually keep the case open and they follow up with you after your appointments to see if you're satisfied with the match. And that's when they close the case, when they know that you are actually with somebody that you think will be able to help you.
So I assume they've tried this elsewhere with this same group. And are there any statistics or anecdotal stories?
Yeah, it was, this wasn't our idea. This is actually, many communities around us have the service also. And we are working with Norwood Hospital, who contributed to the contract to funding the program. We're working with Norwood Hospital to get the word out to physicians in the catchment area of Norwood Hospital because, like I said, many of the communities around here have the service, and it's not well publicized, so many people don't know about it. So we want to make sure that it's utilized. We have a 2-year grant to pay for the first 2 years. We're actually partnering with Walpole. So it's both communities with contributions from Norwood Hospital and some grant funding. We're able to pay for the program. The program does a really good job of tracking data also, not only how many calls, but where they call from, the ages, and other needs. So what we do is hope with these 2 years to track that data, and if we see high usage and we see good use of the program, we hope to be able to continue it through other funding.
Is it very expensive?
It is. It is $12,500 a year per town.
Okay, and so you said this, I'm sure, is it 24 hours?
No, I'm sorry. So I did want to emphasize it's a helpline. So it's someone that is looking for treatment. It's not for an emergency situation. So it's not 24/7. It's Monday through Friday, 9 to 5. And it's really, again, someone that's looking for outpatient treatment.
So it's not, so my scenario, it really wasn't a good one at the beginning. It's more like, you want to see a provider and you just don't know where to turn to find out who they are.
Well, I think your scenario was accurate.
Okay.
Like I'm not, like, something's wrong, I don't feel well, I'm depressed, I'm anxious, I think I need to talk this out with somebody, I need some care, I need some mental health care. I think that is a proper scenario. What it's not a scenario for is I feel like I'm going to hurt myself or others. Yeah. Those emergency situations where you really want to call 911. There's also Riverside Emergency Care, the crisis hotlines. Those are the lines you want to call if you or a loved one is really in danger. And we want to emphasize that because we want to make sure people understand this is a helpline, not a hotline.
Okay. I'm glad I brought you back to that.
A lot of it, we actually find in our neighboring communities that the schools are usually the biggest user with youth. We see rising mental health, both anxiety and depression in our youth, and we know the connections with substance use and mental health. So we want to, again, work on the prevention side, like public health is always working on prevention. And if we can address the issues before they become more serious. Okay. So before we get to the hotline.
Sure. So what else is happening down at the health department these days?
What isn't happening might be a shorter list. We have a lot going on. Actually, just this morning, the program director, Aubrey Sigalle of our Drug Free Communities Grant, Impact Norwood.
Who has been on this show.
Yes, definitely, and has done a lot of work with NCM, so I want to thank you for all that work. We put up a photo voice gallery in Town Hall, and we hope that this will be traveling throughout the community. But it just went up, like I said, today, and it's photographs from youth from 4 communities, including Norwood, of alcohol in their environment. And a photo voice project is just a simple way to show somebody's point of view, whether it be a social justice program or a youth program, but showing what their perspective is of alcohol in their community. And it also has really powerful quotes up from the youth that participated. So I encourage everybody to take it's right on the ground floor of Town Hall, right outside the health department. Come take a look at it.
I'll have to check it out. How's the flu going this year? Any stats on that? I know you're not preventing it, but what's going on with the flu this year?
Well, we definitely try to prevent the flu by getting the vaccine every year.
Yeah, that's true.
We got a prevention for everything. So we encourage people to get the flu shot. We do offer it in October, and usually by November we are out of the vaccine that we purchased, but we still encourage people to get it. We are seeing some rise in flu. The chart has kind of gone up and down. It was tracking similar to last year, which made us a little nervous because last year was a particularly bad year. Usually in epidemics, particularly in flu, you see a spike and then a decline, and then the second spike, which is usually bigger. That's just the trend of a virus through a community, through a population. So we saw the first spike, and then it went down, and it's kind of been it always looks like a stock market graph to me. It goes up and down, but usually the trend is up or the trend is down.
Yeah.
So it's been sort of level, so we're waiting to see that second spike, and this is typical this time of year to start to see a higher level of activity of flu. But not only getting the vaccine, but we always encourage people, stay home when you're sick, wash your hands. Flu virus is droplet, so it's about a 3-foot, if you're near somebody, it's not close, it's not, if you're in a room with somebody with the flu, you're not gonna get it, you have to be in close contact, is what I'm trying to say.
Yeah.
So hand washing, cleaning, staying home when you're sick.
Very good. Anything else that I'm not remembering that you guys are doing right now?
Yeah, so tomorrow we have our AED CPR certification training for our town hall staff. That's something we partner with a lot of the departments on. Norwood is designated as a heart-safe community because of the AEDs in the community, not only in public buildings, but also private buildings, grocery stores, gyms, like that. So we have a lot of AEDs, but I always say the more you train people, the more likely they're going to use it.
Yeah.
So we also want a trained population on first aid, AED, and CPR. So we're doing that tomorrow.
Very good. We did that at my office a couple of years ago.
Oh, good. It's something
as you said
everybody.
that, it's probably time to get retrained or whatever, renewed, whatever.
And they simplified it. It's hands only now because they did the research and they found out that you don't need to do the mouth-to-mouth
Right.
anymore. It's just a chest compressions.
Okay. Anything else?
Yeah, we are preparing our annual report this time of year, looking back at 2018. And one of my goals, along with how we're trying to improve our software and our data collection in the community in Town Hall, one of my goals is to get some better measures of what we're doing and what works and what doesn't work, particularly in our food program. We track things like how many inspections we do, but I think there's a whole lot of information there that gets lost, that doesn't get looked at year to year. Trends in violation, what sort of enforcement tools work. So what I'd like to see eventually in the next couple of years as we start to really improve our technology in the government, that we are able to track data sets like that and look at them year to year and see really where our gaps are and
Sure.
where we're successful, because without evaluation we don't know what we're doing.
See, yours is one of those departments that people don't realize how much you guys do,
Yeah, well, public health, affects a lot of things, and it's connected to a lot of things. And really, the direction of public health these days, they're calling it, Public Health 3.0 in the last couple of years, is talking about what really affects our health. And it's the community, it's the environment you're in, socioeconomic factors. So it really touches on every part, whether we're talking with the trails, about making walkable communities, encouraging physical activity, whether we're dealing with the farmers market to encourage access to fresh vegetables, Earth Day, clean environment, affects your health. So really, any coalition or group out there, we want to get involved with, because it is connected to your health.
Sure. Well, great. This is so informative. You have to come back more often.
I
because
do.
there's so much stuff going on,